Hello, welcome to Vet Talks with Doc Athena. Let's talk about vaccine for dogs. There are core and non-core vaccines for animals. This video is intended as a guide for pet owners, veterinary medicine students, and basically to anyone who is interested in this topic. Canine distemper. Canine distemper is a viral disease, particularly morbillivirus from the family Paramyxoviridae. This disease is an acute to subacute. All right, that means acute, short period of time. Subacute is between acute and chronic. When you say chronic, it runs for a long period of time. Okay, so acute is about a month. So subacute could be more than a month, but maybe less than around 3 months. All right. Aside from that, canine distemper is a very fatal disease. Okay, and very contagious. All right. So that's why in our discussion later, we will mention that animals that are suspected to be suffering from canine distemper should be properly isolated so that it will prevent the spread of this contagious disease. CDV causes immunosuppression. That means the natural defense mechanism of the body is weakened. This renders the body of the host or the patient to be more susceptible to other diseases like secondary bacterial infections. Canine distemper usually affects the carnivores. Okay, so these are animals that eat mostly meat. Okay, like the canidae, and therefore we are focusing this disease on our pets, mainly dogs. Okay, and that's why this is one of the core vaccines in dogs because it is very contagious and fatal, and it has been reported worldwide. So more likely in different countries, you will see that canine distemper is part of the core vaccines for dogs. This disease also affects both young and old animals. However, younger animals are more susceptible, basically because their immune system is not yet well developed. However, adults could also be infected, especially if they are not vaccinated against canine distemper. This disease is called disease of unvaccinated puppies because it mainly targets the young animals. Okay, so how are animals get infected by this virus? Mainly through airborne or exposure to respiratory droplets, and the virus would usually invade the hosts through the respiratory tract, and it is where the virus would replicate and it will travel to different parts of the body, invading different organs. That's why this is called as multisystemic disease because it involves several body systems. While it is true that this is a fatal disease, there's a mild form and a severe form. So the symptoms would depend on the severity of the disease. What are the signs that we could usually observe? Well, in mild cases, there would be fever and ocular or nasal discharges. Apparently, if the patient is sick, then there would be inappetence or decreased feed intake and the more common depression. Okay, these are the signs that we would observe in mild cases. However, if there's already a secondary bacterial infection, then we would also see some signs involving the gastrointestinal tract and respiratory tract, such as pneumonia. Later, we will consider this in our diagnosis. Okay. Next, it might also involve the central nervous system. So once it attacks the central nervous system, then it could be fatal already. All right. There could also be some optic abnormalities such as uveitis. In some cases, There's also some hardening of the foot pad and the nose. That's why this disease is also called as hard pad disease, okay, referring to the hyperkeratosis on the foot pad. There could also be enamel hypoplasia in neonatal infection. This is very important because we're referring to carnivores and their teeth is very important for their survival. So how is canine distemper diagnosed? Well, of course, history is very important. Is the animal vaccinated? Was it exposed to other animals? That could be possibly the source of infection. Your fur baby could be vaccinated, but it could have been exposed to an unvaccinated animal. There's no 100% protection from vaccines, all right? However, it could lessen the severity of the disease if they are vaccinated, and therefore, the chance of survival is way much higher. Okay, other things that your vet might ask is the patient exposed to other animals? Did your fur baby play with other fur babies? Or did you leave your fur baby in a hotel or boarding canal while you were away? Or probably did you enroll your fur baby in a puppy training? Or did you leave your fur baby in a grooming facility and you're not sure if it has been exposed to other fur babies? Or did you leave your fur baby in your cousin's or in your friend's place that possibly has other dogs as well? Maybe not your friends, but maybe in his or her neighborhood, right? Other diagnostic techniques. Well, of course, lab tests are necessary for diagnosis. So what are the samples that could be taken? The blood. Of course, for CBC, biochemistry, and serology. Urine could also be collected for urinalysis, and the same thing for RT-PCR and other procedures as well. Antibody titer and viral identification are very important in disease diagnosis. All right, so please be cooperative when you go to the hospital or to the clinic. If the vet says that these samples are needed, please don't hesitate, okay? Because it could save your fur baby's life, all right? Other things that could be done could be imaging. Why? Because radiology could tell us how severe is the pneumonia of your fur babies, all right? So it would tell us how infected the lungs are, how severe the case is. And this would help also in the treatment protocol of your vet, all right? In severe cases, CT scan and MRI or magnetic resonance imaging could also be done. Why? Because in most cases, there's a neurological signs, okay? And of course, this would involve the central nervous system, particularly the brain. And the severity of the disease could depend as well on which part of the brain is infected. Is it the gray matter or the white matter? All right. In some unfortunate events, some severe cases, if the patient was not able to survive, then necropsy could be done. And they would check the gross lesions as well as histopathological lesions from the organs that were collected. And from there, usually they would see inclusion bodies. Now, the question is it treatable? For treatment, of course, time is very important. Yes, it is treatable. However, it depends on the severity of the case when it was brought to the clinic or to the hospital. Okay, yes, it is fatal. However, it is treatable. Since this is a contagious and fatal disease, usually the patient is admitted. So, inpatient, all right? And usually isolated. This is usually to prevent the spread of the disease and infection of other healthy animals. ICU. Why? Because close monitoring is very important in this case. Patient could also be given with heterologous immunoglobulins for passive immunity. The dose and the frequency depends on the severity of the case based on your vet's assessment. Symptomatic treatment could also be applied to address, for example, convulsions. Okay, so anticonvulsants would be given. However, there are also some drugs that are contraindicated such as corticosteroids. Why? Because corticosteroids are immunosuppressants, okay? So we have mentioned earlier that CDV causes immunosuppression, so giving corticosteroids would exacerbate the condition. Since we also mentioned about secondary bacterial infection, then it may warrant also the use of antibiotics. That is to prevent, or that is to address the condition caused by the bacteria, such as pneumonia. However, be very careful with antibiotics. This should be properly prescribed by veterinarians. In this case, tetracyclines and fluoroquinolones are very dangerous as well. Especially, we have mentioned enamel hypoplasia. In this case, supportive care is also very important, such as fluids, intravenous fluids, nutrition, because we have to make sure that the immune system of the patient is revamped, or we could actually bring it back to normal so that it could naturally fight the infection. IV fluids to keep the patient hydrated, proper nutrition, of course, for recovery. So we have mentioned that this disease is very fatal. Sometimes if it's already too late, the prognosis could be poor. However, of course, if you were able to bring the patient to the hospital or to the clinic early and it has been diagnosed properly and proper treatment had been implemented right away, then more likely the patient could be saved. Don't worry, there are many successful stories that patients were able to survive CDV. And the good news is this disease is preventable. Okay, so let's not wait for our fur babies to suffer from this disease, all right? Please, this is preventable by vaccination. Okay, that's why this is one of the core vaccines for dogs. Yes, it is fatal but preventable. Okay, so that ends our short discussion about canine distemper. Thank you for being with me here at Vet Talks with Doc Athena. I hope you learned something from this simple lecture, and if you did, please hit the like button. Also, if you haven't subscribed yet, please do so. You can reach me at Doc Athena Facebook page. Again, thank you, and I hope to see you again soon. God bless us all. Bye!